Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, March 31st. Hard to believe. I'll now turn things over to Dr. Fitzgerald for an update on today's numbers.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us. Since the media advisory yesterday, we have one new confirmed case of COVID-19 in our province in the Eastern Health Region, and the individual is between the ages of 40 and 49, and the source of this case is under investigation at this time. The total number of cases in our province is 1,019. There have been 2 new recoveries in Eastern Health, leading to 3 active cases in the province. A total of 124,261 people have been tested to date. Whole genome sequencing has identified that one of the cases we recently reported was a COVID variant, the variant that was first discovered in South Africa, B1351. The case was travel related, and the individual properly self-isolated and had no contacts. We are confident there was no onward transmission and no danger to public safety. We are asking that all passengers and crew who traveled on the Marine Atlantic vessel Atlantic Vision from North Sydney to Port aux Basques Saturday night, March 27th, arriving on Sunday morning, March 28th, to arrange for a COVID test. We are making this request out of an abundance of caution related to a case announced yesterday. These individuals should book their test using the online assessment and referral tool on our website and indicate the reason was due to a public advisory. We are a few days into level 2 across the province with Easter weekend approaching, as well as Easter break for students. The Easter Bunny is, of course, an essential worker and will be permitted to enter the province. Visits with the Easter Bunny in large public venues, such as shopping malls, are not recommended. If the Easter Bunny does visit a public space, any in-person visits should be by appointment only, with no lineups forming. Individuals must maintain 6 feet between themselves and the Easter Bunny. Easter is traditionally a time for many to gather with family and friends to attend faith-based gatherings. While we encourage you to do so safely, in this new level 2, we need to keep our close contacts as low as possible. You should maintain your close social interactions to a maximum of 20 people for your household, and these should be consistent, and they should not change from day to day or week to week. By close interactions, we mean indoors, without a mask, in close proximity to one another, such as those seated together at a restaurant or in a home. Remember that you should not bring all your 20 close contacts together at one time, as they are not likely all in each other's bubbles. If you do host a gathering, keep it small and ensure everyone is a close contact of one another. Any gatherings should be distanced as much as possible, meaning people should be able to stay at least 6 feet away from each other, and the amount of space you have will determine the number of people that can safely attend. Sharing food or serving utensils is not recommended, as this may increase the risk of transmission of COVID-19. If food is necessary, have one individual designated to serve food after washing their hands and while wearing a non-medical mask. There should be no self-serve options such as trays of cookies, bowls of chips, or potlucks. If the weather permits, choose outdoor interactions over indoors. Further guidance is available on our website under holiday events and gatherings. It is important to repeat why we are asking for everyone's cooperation in this. In the last outbreak, there was clear and rapid spread of the variant through households, social circles, sports events, workplaces, and schools. We were living as if COVID were not here, and that did contribute to the swift spread. We must always assume that COVID can be anywhere. And please, if you have any symptoms of COVID-19, even if it is just one mild symptom, book a COVID test using the online assessment and referral tool. We are now receiving a steady supply of vaccine. Approximately 63,000 doses have been administered, and almost 10,000 individuals have been fully vaccinated. Regional health authorities are expanding to additional priority groups as vaccine becomes available. If you are over the age of 70 and have pre-registered for your vaccine but have not yet been contacted, please know that you will be soon. If you did not include an email in your registration form, you will be contacted by phone. Other priority groups may be receiving vaccine at similar times, but once you become eligible, you are always eligible. You will not be left out. If you receive an email to book an appointment and there is no appointment available, please continue to check back, as clinics are being added regularly. Please note that the pre-registration telephone line is available only for pre-registration, and the individuals staffing the line cannot book your appointment for a vaccination. The line has seen significant increase in traffic in recent days. As a recap, for those who may have just joined us, we have one new confirmed case since yesterday's media advisory, and the total number of cases in the province is 1,019. This time of year is always hopeful. We hope for an early spring and a pleasant summer, and this year we are once again hopeful that we will see an improvement in the COVID-19 pandemic globally. Let's focus our attention on controlling what we can, protecting one another, and keeping COVID at bay. Hold fast, Newfoundland and Labrador. Thank you.
Oh, thank you, Dr. Fitzgerald. Well, we are in the last day of the third month of the year. And while it's cold, it's another beautiful day here in St. John's. The days are getting noticeably longer. This coming weekend, many people across the province will celebrate Easter. It's another sure sign that spring and eventually summer is here. With the recent easing of public health restrictions for the whole province, I hope you get a chance to safely spend time with your friends and family. As summer is fast approaching and more people are getting their vaccinations, you can sense, as Dr. Fitzgerald said, that hope and optimism about returning to a more normal lifestyle is in the air. I know the recent change in the guidance of the AstraZeneca vaccine may be concerning, but I want to reassure you that the chances of those issues arising are still incredibly slim. Federally and provincially, everyone is pivoting quickly to ensure people get vaccinated as quickly as possible. And we are getting there too. But as we have said many times, we must continue to learn to live with COVID-19 by following the guidelines set forth by Dr. Fitzgerald and her team at Public Health. So with that, I'll turn it over to Dr. Haggie for some brief remarks. Minister Haggie?
Thank you very much, Premier. A little update on vaccine as of our report, which is compiled on a weekly basis. Of the morning of the 29th, we've administered 62,849 doses. We are currently about 600 dose administrations behind our target. We've had several clinics, particularly on the western side of the island, cancelled due to weather. We're expecting just under 17,000 doses of Pfizer, and in actual fact, those arrived yesterday. And the need, I'm informed, in Central Health, they're actually being administered as we speak. We're also expecting this weekend another 8,400 doses of Moderna vaccine. So we are on track for our April 4th Easter weekend target of 80,000 doses administered. There may be a little bit of slippage because of the weather, but I would expect we'll be within 1,000 of that, even under worst-case scenarios. We're also, because of the reliability of Pfizer's supply chain, on track for Canada Day, Memorial Day, to have a shot in the arm of every eligible person who wants a COVID vaccine. That has not changed, and indeed, there are some suggestions that we could actually have already started administering second doses by that time too. For those people who are concerned about their appointments, I know that Eastern Health is releasing a statement very shortly, as has Central Health. If you have pre-registered, there is no need to call. You will not be forgotten. The clinics are being rolled out, and I think we've spoken to the RHAs to try and make sure those appointments and the availability geographically spans a long enough period, say 4 or 5 weeks, whereby people can pick and choose a little bit about where they would see the geography working best for them, so they're not having to drive, particularly for some of the frailer over 70s. We will notify people via this means at the end of that process, when everybody who is in that age group of 70 plus has been vaccinated. Currently, Eastern Health are telling me they will have offered a vaccine to everybody over 70 in Eastern Health by April 23rd. So the fact you haven't heard simply means they haven't got around to you yet. No one has forgotten you. It is a time of the year where family get together, and there are a variety of religious traditions at this time of the year. Some people, however, are still significantly stressed, either over their own mental wellness issues or around COVID and its stresses, or indeed around vaccine. There are resources available to you. Bridgethegap.ca is a homegrown one. Doorways for those who would prefer something in person. There is also our federal counterpart at Wellness Together, or one word, .ca, which provides services of a similar nature, online and via phone. It also provides ready access for those whose first language is not English, particularly our Indigenous residents and those from other countries who are first-generation Canadians. So I would recommend that to you as well. So if it is your tradition, then happy Easter. If not, then I hope you have a peaceful weekend. I am advised by communications that we will not be issuing news releases over the holiday weekend, Friday, Saturday, or Sunday, and we will resume on Monday. Obviously, if the situation changes and there's a need, we will take that as it comes, and we'll make that information available publicly. So with that, Premier, happy Easter, and back to you.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. It's looking like Western and Eastern Health allowing for AstraZeneca clinics at the end of this week to move through the limited amount that's about to expire. The age range for that is 55 to 64. Just wondering why that particular age range and why the cutoff would be 64.
Just basically because we had said before that anyone over the age of 65 with a higher risk of severe complications from the from COVID would be eligible for the mRNA vaccine. So we are targeting people in that age group for the AstraZeneca.
Thank you. And Minister Haggie, you noted that anyone who's pre-registered, not to worry, you haven't been forgotten. I'm still hearing from a lot over the age of 85 who have not yet received an appointment. They're obviously getting concerned that they have been forgotten, having pre-registered when it first opened, I want to say more than a month ago at this point. Why aren't we moving through it by age range at this point if Eastern Health is now looking to start contacting for 70, 79 when there's some who are 86, 87 who haven't been booked yet?
I think the important thing is that some of that is dependent on geography, and I think it would be very much down to local context around that. Some of those individuals, if they have had difficulties, they have a code for registering, obviously, but they also have contact for their local public health. My understanding is that it is simply a process of rolling these out. We are pre-registering 70-year-olds, but currently administering to 85 and 80-year-olds, and then working back. So there may be some local challenges in terms of availability of clinics, but we've had a discussion with the RHAs today to make sure there is a geographical variation so that people, particularly of that age, don't have to drive any further than they need to. So that's probably the clearest answer I can offer just at the moment.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, I have a couple of questions about AstraZeneca. Why are we still not offering this to anyone over the age of 65, given the new guidelines?
Probably best.
I I think it's the same answer that I said to Kellyanne's first question, which is we've decided that people at higher risk will get an mRNA vaccine, high risk for severe disease, and so we certainly see a gradient over 65. So we are offering AstraZeneca to 55 to 64 at this point. So
should we expect more of these parallel vaccination clinics like we're getting this week?
We may very well have those as we get more vaccines online. We have, there are other vaccines in the queue that we will likely be getting as the months go on. So we may find that some are more suitable for one group than another, and so we may be using them. There may very well be parallel streams.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. New information from Pfizer. They're saying that their vaccine is 100% effective in kids aged 12 to 15. Dr. Fitzgerald, what do you know about this, and how could this affect our rollout plan?
So I know about it, likely what you know about it. So we've not received any, formal indication of that. As generally happens, it's not that there's anything out of the ordinary happening there. But we look forward to Pfizer's reports on what the how well the vaccine performed in that age group. Obviously, it's a big deal for us, for everybody, to be able to administer vaccines to this age group. So we'll certainly be looking forward to those reports when they come out. And, once Health Canada has a chance to review that and the National Advisory Committee on Immunisation has a chance to look at it, then we'll take direction or their cues from them as to how best to use it.
And still getting a lot of concerns from people regarding booking their vaccination appointments by phone. I heard from someone this morning in the 80-plus age group who said she's been trying repeatedly to get through by phone to book her vaccination appointment, but hasn't been able to get through. What sort of backlog are we seeing in terms of people calling to book vaccinations, and what is government planning to do to address those backlogs?
From the point of view of the call center, I do know that several things have happened. One is they've increased the number of staff available to handle calls, and that they're also trying to divide those staff out to take a slightly more regionalized approach. One of the challenges that they are having is that phone line is being bombarded by people who are asking if they've successfully registered, and it's proving to be taxing. So that's part of Dr. Fitzgerald's comments and mine about using the phones appropriately. If you have registered and got a screen that says you've successfully pre-registered, or in some jurisdictions now, I believe Eastern Health are actually sending out email confirmations for those people who have used that method, that really there is no need to call. Eastern Health, as of an hour ago, say that they will have offered appointments to everybody in the 70-plus group by the 23rd of April. And the other RHAs are committing to get back to people who have pre-registered within a 14 to 21-day window as well, and they will be providing updates on that.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Minister, I want to just ask about the 80,000 threshold. Originally, you were saying that by the end of March, we were expecting to administer 80,000 doses. Now, I noticed you were saying it looks more like it'll be the Easter weekend. Can you give me an idea when exactly do you expect to reach that threshold, and why didn't we reach it by the end of March as expected?
My comments over the last 10 days, probably even 2 weeks, Peter, have been 80,000 by Easter. And we've always worked internally after my initial comments with April 4th as a deadline. Two factors play into that. One, principally, has been the weather on the West Coast. And then there were some initial concerns about whether or not we would be able to backfill the younger group for the first responders with mRNA vaccine, and then whether that would leave us short for that. But between the jigs and the reels, we will be, I think, somewhere within a 600 to 1,000 margin by the 4th. So I'm hoping it will be 80,000, but I won't be surprised if it was 79 and change.
And I want to ask about schools. They've said with the current guidance that high school classes can't resume in person. Dr. Fitzgerald, do you expect to change that guidance at all over the next couple of months until we have people vaccinated, considering our case numbers right now have returned to very low levels, and a lot of people are frustrated about the fact that their kids are not able to go back to class?
Yeah, so certainly we've been having discussions about that, and we made our guidance based on what we know about variants. We know that a significant proportion of the cases we're seeing now in the rest of the country are due to variants, and Ontario is somewhere between 60 and 70% of their cases are variants. So that's a concern, because it does mean that any of these imported cases, eventually most imported cases that we see, are going to be related to a variant, and that's what we would expect with a virus that spreads more quickly than the original form. So we based our advice and our recommendations on that knowledge, and so right now we certainly are sticking by those recommendations. As we get more people vaccinated, as the rest of the country gets more people vaccinated, if we see, there's a significant impact of that on spread, if we see that case numbers are starting to go down elsewhere, and if we feel that we're more comfortable with the epidemiology, then certainly we will be looking at that. We reassess things on a regular basis. We're always asking those questions. We meet as a team on a regular basis, 3 to 4 times a week, and we ask all of those questions as to what measures we have in place and if we can change them. So it is something that we're continually reassessing, but right now it stands as it is.
Thanks.
Our next questions are from Danielle Edwards with the Canadian Press. Please go ahead.
Thank you. I wanted to ask, and I think this is best directed to Dr. Fitzgerald, of the AstraZeneca vaccine doses that are rapidly getting close to the expiration date of April 2nd, how many have been used so far? Is there any concern? Are there any concerns? About any waste?
Clinics that are happening this week, both in Eastern and Western, should actually use the last of that vaccine that was due to expire at the end of this week. So we don't anticipate a lot of wastage with regard to that vaccine. In fact, there was quite a good response actually to the call out in Western Health. So we're quite pleased about that.
And I also wanted to ask, with the information that we've gotten from the NACI about the concerns of people under 55 being administered with the AstraZeneca vaccine, are there any plans to put the vaccine to one side for certain age groups with future shipments of AstraZeneca specifically?
So at the moment, we'll be offering AstraZeneca, in the age group that we've indicated, and certainly we're looking at exactly how we pivot and do that appropriately at this time. And in the coming days, I expect we will have more definitive information about that. But right now, the goal is to offer in the age group that the 55 to 64 that we've indicated, and that can be for most priority groups. So we'll be looking at that a little more closely in the next day or two.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. When it comes to vaccinating, are we looking to vaccinate through weekends, on evenings? People just concerned that we're not utilizing the time available.
The regional health authorities are running vaccine clinics certainly into the evenings and certainly on weekends. Whether or not specifically with relation to Good Friday and Easter Monday, I would actually have to go back and check. Excuse me. I honestly don't have an answer to this weekend, but previous weekends certainly and previous evenings they have.
Thank you. Premier, the Registered Nurses Union has sent a letter to you about nursing shortages impacting care in communities across Newfoundland and Labrador. They say the province has made promises that they haven't seen any movement on yet. Just looking for your response on this.
Thanks, Kellyanne. I haven't seen that letter. Did you say, you broke up a little bit there, did you say the Nurses Union?
Yes, the Registered Nurses Union.
Yeah, no, we've had some good conversations throughout the COVID outbreak with the new president of the Nurses Union, and looking forward to having good discussions into the future. I have not seen that letter yet, but I look forward to reading it and working with them into the future to address the nursing needs.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, I'm talking about the 80,000 figure. By my count, you'll need to administer up to 4,000 doses a day of vaccine before Easter to reach that. Is that possible?
I'm not sure where you get 4,000 doses a day. That figure was from March the 29th, so we have 5 days and just over 17,000 to do. I don't see a challenge in that.
Okay. And this is a question that always comes up, but I have to ask it again because I hear it from a lot of quarters. If capacity is not an issue here, why are we consistently at or near the bottom of the scale when it comes to per capita vaccinations in this country?
Well, you can go ahead, Minister, but we're not is the answer. Go ahead, Minister. You can you can deliver the technical details.
I was going to say we're not. A lot of it is down to a variety of factors. We, for example, I mean, there's a shipment of Pfizer that really had no time to cool off in the province before Central Health had it thawed and were administering it, literally within 24 hours of it coming. That is fairly typical. We are a territory. There are transportation issues. We've had clinics cancelled on the Port aux Basques area, for example. We had a 2-day weather hold for the coast of Labrador. So depending on what day of the week you look at it and what day you pick your figures for in and out, you will get a percentage that varies between 60 and 95%. And that is not at all outside what you see in other jurisdictions.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Dr. Fitzgerald, how concerning is it for you to see that the South African variant has reached our shores?
Well, you know, we're concerned about the variants in general. I'm not surprised that we've seen cases of it. It's expected that we would see cases of this variant. You know, we have people who are traveling for work. We have people who are traveling for other reasons and are traveling to areas where we're seeing more of this variant. So, you know, not surprised that that's happening. We're seeing it in other places in this country. So, it's obviously any variant that is more easily transmissible, and especially this one, which has, you know, some vaccine escape. We certainly are concerned about it getting into the province and spreading. Thankfully, the person that we, you know, that had this is they isolated quite appropriately and had no further contacts. So that's all really good. But that's just shows the importance of following the public health measures and, you know, making sure that quarantine rules are followed, making sure that we all do our part to try to limit spread of COVID as much as we can. So making sure we're keeping our contacts low and maintaining our distance. It's all really important to reduce the spread of any variant really within the province.
And what do we know about this variant? How is it different from the strains that we've already seen here?
So it's a little bit different, and basically what we're seeing is that it's got some similar mutations, so that it can spread a little bit more easily than the original COVID variant. And in addition to that, it appears to have some mutations that, for some reason, allow it to not be as susceptible to the vaccine. And in particular, we've seen some of the viral vector vaccines that's been an issue with. So, it's slightly different. I couldn't really get into all the details of how it's different because it's a little bit out of my scope. But, the biggest concern for us right now is just how easily these variants are transmissible. And that's the most important reason why we need to make sure we're keeping our contacts low and following those public health recommendations and guidance.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
As the weather starts to warm up and businesses try to figure out what the summer is going to look like for tourism, Dr. Fitzgerald, I'm wondering if you can provide some context on what specific things are you going to need to see here and in the rest of the country for you to determine that it is safe to open up and allow tourism?
So for, I guess, first of all, allowing tourism is not necessarily what I would say. It's just removing travel restrictions, and then what happens after that, I guess, is what happens. But we obviously, vaccination rates will play a role in that. We certainly would like to see a positive vaccines that have a positive effect on transmission. Obviously, we'd want to see a good proportion of our population vaccinated, as well as in the rest of the country. We'd certainly want to see reduction in rates elsewhere in the country, as well as maintaining our own rates at a low level. So all of those things really would be important for consideration when we make recommendations with regard to travel.
And this is a question I'm hoping to get a response from both Dr. Fitzgerald and Minister Haggie on. How important was the contact tracing team in getting the most recent outbreak under control so quickly?
How important was the contact tracing team?
Very.
Yes.
They were essential. Like we would not have gotten that outbreak under control without that contact tracing team. We did, there is a lot that went into making sure that outbreak came under control. Aggressive contact tracing, aggressive testing, that was really important. The restrictions that were put in place, that was really important as well. But making sure that we found every case of COVID in the province was certainly very, very important. And to be honest, everybody had to pull together to do that. We had to bring in extra contact tracers. We had help from other regions, in addition to everybody in Eastern Health, all hands on deck there. And I have to say they did a fantastic job. And we wouldn't be where we are if we didn't have the team that we had, for sure.
Peter, imagine trying to change a flat tire on a truck without a jack and without a tire iron. That's what you're doing if you don't have contact tracing in the middle of a pandemic. It's crucial. You can't live without it.
Thank you.
Our next questions are from Danielle Edwards with the Canadian Press. Please go ahead.
Hi. This question I think is best directed to the minister. I just had a question about that number you'd mentioned, 600 appointments having to be rescheduled due to inclement weather. Are there any concerns that that's also going to get in the way of pushing back the goal of having 80,000 vaccinated, or 80,000 doses administered, rather, by the end of the weekend?
Yes, that's my slippage. That's where I think we may come adrift. We may make it up. We had an excellent response, for example, for the open call in Western Health that Dr. Fitzgerald referenced. There were 480 appointments. The website went live at 4:30 last night, and by 8 o'clock this morning, 417 of those appointments were already filled. So Eastern Central Health, we're actually waiting for the vaccine to be checked out by Pfizer and the temperature control before they started administering today. So vaccine delivery is the key to this, and I think the slippage there may well just be around that weather hold.
Okay, thank you. No further questions.
I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
Yes, mine's referring to the mobile testing unit in Grand Falls, Windsor. It's open 8 to 8, 7 days a week, but it's close to the long weekend. So for those who are getting procedures done on Monday and Tuesday and need a test done previous, they're now having to travel away from the community. Their fear is that the testing site is going to close permanently and move to Gander. I'm wondering if this is something that is in the works.
That's an operational issue for Central Health. I've not been advised of any substantive change to testing sites across Central Health. Indeed, I've not been advised of any substantive change to testing sites across any of the regional health authorities. Those are operational issues that are probably related to the holiday weekend. Central Health would be able to provide some more clarity about that.
Thank you.
Peter Jackson with The Telegram, do you have a final question?
I do, and I'd like to follow up on vaccination numbers. I'm wondering, Dr. Hagee, in the interest of transparency, and since you claim the province's performance is up to 20% better than that regularly posted on the National COVID Tracker Hub, would the department be willing to host or provide fresh vaccination numbers on a more frequent basis to demonstrate that?
One of the challenges that we've had around vaccine is reconciliation. A lot of the rural sites rely on a paper base, so there's an inherent lag in there. And we also, unfortunately, yet have 2 or 3 different electronic systems before they feed into the COVID tracker. Certainly, reporting of vaccine administration is something we've looked at, and whether or not we should report it slightly differently in terms of numbers of vaccine shots given daily, for example. But again, there's a kind of lag issue there. Number of appointments kept, for example, maybe another more readily accessible daily statistic. But if there's some particular way of reporting you'd like, Peter, please let us know.
I will. Thank you.
Richard Duggan with BOCM, do you have a final question?
I do. Given the number of variant cases being seen across the country and the fact that we have now seen 2 variant types in this province, are we considering more asymptomatic testing or other forms of testing, such as point of entry, to catch the variant?
So those are all things. Well, certainly we have instituted some with rotational workers, and we are looking at how best to use testing for variant detection, and we're working on that with essential workers as our next group that we're focusing on. And so, yeah, we are looking at how testing can be helpful in this regard. So.
Peter Cowan with CBC, do you have a final question?
I do. We saw the federal government announce that nationally there's 5 million doses that were going to come late in the summer, now going to come in June. For this province, that should work out to about 70,000 or so doses. What does that do to our vaccination timeline?
Well, Peter, we're still working on the actual timeline and what implications it'll have, but it certainly gives us a buffer into, as Minister Hagee said at the very beginning, making sure that we reach that July 1st, end of June deadline, and even allow us to provide perhaps the second doses a bit earlier. Depending on what research comes out and what evidence is available, not to speak for Dr. Fitzgerald, but it could even open up potential for children, depending on what evidence is available and how we change our guidelines based on that evidence.
Danielle Edwards with the Canadian Press, do you have a final question?
Yes. I am curious about the variant as well, considering that there is a case of the South African variant has been found. Are there any concerns that there could possibly be an outbreak because of this particular variant, as there was earlier this year due to the UK variant?
Do you mean an outbreak as a result of this case, or
Yes.
just no? The case is now recovered, and there's been no onward spread of the variant in this case.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us today. Again, another good day in Newfoundland and Labrador with respect to COVID-19. Let's continue, though, to keep doing our part, to keep the numbers low and to keep that momentum moving forward as we reach for higher vaccination numbers. Please continue to support local businesses where you can, especially those in the hospitality and tourism industry. They've been particularly hit hard in this pandemic, and I know they appreciate everybody's support. So please enjoy safely, following the public health guidelines, the Easter weekend, if you're inclined to celebrate Easter. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
Regular programming already in progress.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
Hey everyone, it is Jason Piercy, host of Out of the Fog on Tuesday nights at 7:30. You're definitely going to want to watch because you never know what I'm going to get into. It's all about community. It's all about you.